Cataracts are one of the most common eye disorders in the world, and they are the main cause of vision loss in the United States. A cataract cannot be seen in its early stages without the use of specialized equipment. A cataract, on the other hand, can cloud your lens as it grows, making the world appear fuzzy and less colored. Cataracts are a change in the lens of the eye that causes impaired vision and, in severe cases, visual loss. It can only be spotted early on with the instruments used by an ophthalmologist during a thorough exam. However, if left untreated, can cloud your lens and change the appearance of the pupil, which is the normally dark hole in the middle of the colored iris. Because cataracts can develop slowly, regular eye exams can lead to an early diagnosis, allowing for earlier treatment and a lesser risk of any vision complications. Cataracts are not usually noticeable in their early stages when viewed in a mirror. A white or bluish-white clouding may emerge in the pupil when a cataract develops. The clouding may become denser and thicker with time. Children with congenital cataracts or cataracts appear differently. Parents frequently see a small white speck in their child's pupil. The entire lens can turn dazzling white and visible at times. A cataract caused by type 2 diabetes may resemble a snowflake or a starburst. A traumatic cataract appears as a cloudy lens on one side of the eye, with injuries to the iris or other parts of the eye evident. So how do you know you have cataracts? You may not notice any changes in your eyesight when a cataract develops. Because a cataract grows slowly, any changes in your vision may appear gradually at first, without your knowledge. Your eyesight will begin to blur with time, and colors will lose part of their vibrancy. You may not have any vision difficulties, but a dilated eye exam may detect a cataract in its early stages. An ophthalmologist will use a slit lamp microscope to examine the lens, cornea, and iris in great detail. This may aid in detecting a cataract before it causes vision problems. So, who is most likely to get cataracts? The majority of cataracts are age-related, with more than half of those aged 80 and up in the United States developing cataracts or having surgery to remove them. Some cataracts, on the other hand, are inherited. Congenital cataracts are cataracts that are present at birth. This disease is relatively uncommon, affecting approximately 4.24 out of every 10,000 infants. Maternal infections, rubella, HSV, syphilis, during pregnancy are a primary cause of congenital cataracts. This kind of cataract affects both eyes and may be caused by a hereditary problem, whereas unilateral congenital cataract is usually caused by another factor. According to experts in the United Kingdom, 1 out of every 5 cases is caused by a family history of this ailment. Other genetically inherited causes of infantile cataracts include chromosomal diseases such as Down syndrome, inherited metabolic illnesses such as galactosemia, and other genetically inherited disorders such as mitochondrial disorders. Genetics may also play a role in age-related cataracts. Researchers discovered 115 genes and 38 disease-causing genes that may be responsible for cataracts. Genetic abnormalities may affect the general shape of the lens, increasing the eye's risk of cataract development. Genes may destabilize proteins in the eye, making them more vulnerable to environmental conditions that cause cataracts, such as UV exposure. Other factors that may increase your risk of developing cataracts, aside from age, include diabetes, a history of smoking and/or excessive alcohol use, a family history of cataracts, eye injury, surgery, or radiation treatment around the eyes, a history of prolonged sun exposure, or use of steroids, for arthritis, allergies, etc. Cataracts are thought to be unpreventable, however everyone appears to agree that their appearance can be postponed. Furthermore, some doctors and scientists believe that cataracts can be avoided. According to research, certain nutrients and dietary supplements may lower your risk of cataracts. Additionally, avoiding excessive sunlight exposure, reducing alcohol use, stopping smoking, and eating sufficient of fresh vegetables and fruits are all simple yet effective measures to prevent cataracts. Here are 4 natural ways to prevent cataracts. Don't forget to subscribe for more videos like this. 1. Diet. The more antioxidants you consume from fruits and vegetables, the higher your chances of avoiding cataract development. Consuming more antioxidant-rich foods protects your eyes from oxidative stress, which contributes to cataracts. Antioxidants also contribute to the maintenance of the enzymatic pathways that prevent cataract development. Fresh fruits and vegetables are generally beneficial to eye health. They contain significant levels of phytochemicals, which are vital plant chemicals. Antioxidants and anti-inflammatory compounds found in phytonutrients have been demonstrated to help prevent or postpone the advancement of eye illness, including cataracts. In addition, studies have indicated that vegetarians and vegans have a considerably lower incidence of cataracts than meat eaters, particularly among the elderly. Vitamin A has been demonstrated to help prevent eyesight loss caused by degenerative diseases such as cataracts and macular degeneration. Carrots, sweet potatoes, and dark leafy greens are excellent sources of this vision-improving vitamin. Vitamin C consumption has been associated to a lower risk of cataracts, particularly in persons who are lacking in this important nutrient. Peppers, citrus fruits, berries, tropical fruits, broccoli, and tomatoes are all high in vitamin C. Zinc insufficiency has also been linked to foggy vision and poor night vision, according to the American Optometric Association, because it helps transfer vitamin A from the liver into the retina. Zinc-rich foods include grass-fed beef, kefir, yogurt, chickpeas, and pumpkin seeds. These are the two carotenoids that have received the greatest attention in terms of cataract prevention. They are powerful antioxidants present in a variety of foods. They are also present together in the eye lenses. Lutein and zeaxanthin help preserve and maintain healthy eye cells by filtering damaging high-energy blue wavelengths of light. According to one study, those who eat a diet heavy in zeaxanthin-rich foods, such as spinach, kale, and broccoli, are up to 50% less likely to develop cataracts. Eggs, collard greens, turnip greens, and corn are also high in lutein and zeaxanthin. Eating fatty fish like salmon and other omega-3 fatty acid-rich foods like chia seeds on a regular basis has been related to a possible lower incidence of cataracts or their advancement. 2. Supplements and herbs. If you don't obtain enough of these nutrients from your diet, high-quality supplements are an alternative for natural cataract prevention and therapy. However, it is strongly advised getting as much of these nutrients through diet as possible. The majority of studies that have found these nutrients to be beneficial have used food rather than supplements. Although there is no suggested daily dose for lutein and zeaxanthin, most studies demonstrate benefits from consuming 10 mg of lutein per day and 2 mg of zeaxanthin per day. Bilberry is well known for its eye health benefits. It includes anthocyanosides, plant pigments with strong antioxidant effects, and vitamin C. Because of its ability to scavenge free radicals, bilberry is a great alternative for a variety of age-related ocular problems. It has been demonstrated to protect against cataracts, macular degeneration, and glaucoma. 3. Sun protection. UV light can oxidize proteins in the eye, altering their structure and contributing to cataract formation. Sunlight exposure has been related to an increased risk of cataracts. Wearing sunglasses and a wide-brimmed hat to prevent ultraviolet sunlight can assist to delay the formation of a cataract. Protective sunglasses do not have to be expensive, but choose ones that completely filter UV rays. While it's vital to limit your daily exposure to computers and other devices that emit blue light, it's also important to receive some sunlight each day for the sake of your eyes and overall health. 4. Lifestyle modifications. Reduced alcohol consumption and stopping smoking are two lifestyle measures that can significantly reduce your cataract risk. Daily consumption of one or more alcoholic beverages was related with a little increase in the incidence of cataract, although this risk increased with higher alcohol consumption. Smoking is also harmful to all aspects of health, including eye health. Tobacco use unquestionably contributes to the development of cataracts. According to research, quitting smoking does not definitely reduce your chance of cataracts, but it does prevent you from accumulating a higher risk. If you experience significant visual changes, such as double vision, consult a doctor right once. Cataracts, if left untreated, can continue to grow and worsen, eventually leading to blindness.